Good afternoon. I'm Csaba Varga, PhD student in the orthopedic department of Semmelweis University, and my PhD program is about the indications in foot surgery, especially in the surgery of ankle osteoarthritis and adult flat foot. The foot surgery is a new field in orthopedic surgery in Hungary. Because of the better facilities, foot surgery has developed much more abroad than in Hungary. I would like to see that the international professional achievements in foot surgery are widely applied in a clinical practice in Hungary, and with my scientific work, I would like to contribute to the development of professional guidelines to make help for orthopedic surgeons with less practical experience in foot surgery to choose the right treatment protocol. The first part of our work is about the role of BMI on success rate of total ankle arthroplasty, which is a controversial issue in foot surgery nowadays. And the other part of our work is the comparison of the many different surgical techniques in the surgical treatment of adult flat foot. Our first topic is the investigation of the safety and efficacy in total ankle arthroplasty in relation with body mass index. Something about the background. As the picture shows, the annual incidence of total ankle arthroplasties has increased quickly in the last 20 years. As the amount of ankle arthroplasties raises, the complication rate is increasing as well. The most important types of complications can be seen on the slide, divided them into local and systemic complications. Some of the complications require revision procedures or long, heavy, and expensive aftercare. The ankle arthroplasty procedure works with a higher complication rate as the hip and knee arthroplasty. Therefore, is it crucially important to know the risk factors of complications to avoid them. There are proved prognostic factors which can lead to these complications, like diabetes, smoking, arteriosclerosis. But what about BMI? The BMI is a crucial criteria in a patient selection in a clinical practice, because the negative effect of high BMI on the outcomes of total hip and knee arthroplasty is proven. But the prognostic role of BMI in case of ankle arthroplasty is still unclear. Body weight and high BMI in general is source of many problems in orthopedics, like arthritis, enthesopathies, overloading joints, muscles, and tendons. So therefore, our aim was to clarify the role of BMI as a risk factor for complications and revisions in total ankle arthroplasty, and the clinical question was the same. Does BMI increase the rate of complications and revision procedures after primary total ankle arthroplasty? And the hypothesis was yes, it increases the number of them. This is the systematic selection, and this is our main result about the revision rate after ankle arthroplasty. According to the selected articles, divided the patients into obese and non-obese groups. The random effects model shows more than 1.5 times higher rate of complication among the obese patients. It means that an obese patient had more than 1.5 times better chance to undergo on a revision procedure after primary total ankle arthroplasty. These results are regardless of the reason of revision, whether they are due to septic, aseptic loosening, or other reason. Some articles provided subgroups with narrower BMI categories, and they are very important. There seems to appear the difference under and above 30 of BMI groups. The next sheet, we performed the analysis for revision without polyethylene insert exchange, and this sheet is about the revision rate only affected the metal component of the implant, and the chance for revision is even higher in the obese population. The next sheet is about all types of perioperative complications, which seems to be more common in case of obesity. And the next sheet is the same about the local complications. These results are not significant because of the large heterogeneity between the populations and because of the overlapping of the complication categories. But based on the first sheet and main result, we can conclude that the revision rate is significantly higher among the obese patients after primary ankle arthroplasty, and the clinical implication will be to predict and avoid the complications and help the selection of the patients. And the complications require financial costs, and it's considerable to change the treatment protocol plan in case of obesity in ankle osteoarthritis. We submitted our manuscript at the second journal 2 months ago, and it's under review. Our second topic is the multiple comparison of the operative techniques for the surgical treatment of adult flatfoot. The prevalence of adult acquired flatfoot deformity is around 15% according to the latest studies, and 7 to 15% of these patients needs to be treated due to the symptoms. The guideline allows multiple choice of operations. This is the flow chart of the surgical treatment of adult flatfoot according to the guideline, and it can be seen that one intervention is involved in several stages, and there are many methods to choose from within a single stage. So the guideline only provides options per stages, but the type of the surgery is currently selected based on the individual decision and the experience of the surgeon. There are little evidence which risk factors influences the success of operations and which procedures leads to better outcomes. Therefore, our aim was to compare the effectiveness of these different surgical treatment methods. And our clinical question is the same as well: which surgical technique is the most effective? Fortunately, we have international scores, and the most important score is this AOFES score from America. This is the American Orthopedic Foot and Ankle Society score. And I hope based on these scores we can compare these surgical techniques. This is our systematic search, and we are making the systematic selection. Again, an overview about the two. The first project was about the role of BMI in ankle arthroplasty, and the second one will be the multiple comparison of the operations for adult flatfoot. I think, in my opinion, our orthopedic profession needs simple rules. Therefore, we asked simple questions, and that's why I would like to close my presentation with a quote of American computer scientist: simplicity is the shortest way to the solution. Thank you for your attention.
Thank you, Csaba. I wanted to ask you that you said that obesity, it proves that obesity can be a risk factor for the survival of the ankle prosthesis, and it can help with the indication whether a patient can have an ankle prosthesis or not. And my question is that, do you think that there are other perioperative solutions that might help that these obese patients, if they have a prosthesis, how can we help for this prosthesis to function in a longer term?
Yeah, there are new operative techniques, for example, or there are other risk factors which can influence the success rate. So BMI only one of them. And based on this, you cannot realize that an individual patient is appropriate for this type of surgery or not. But this value of BMI and this investigation make a help for you to this decision. Yes, I can, unfortunately, I cannot tell you other techniques or other issues or advice, given advice based on which you can help to these patients to get an ankle prosthesis.
Thank you.
Yeah, a comment and a question from my side. Or two questions maybe. The title on the first slide, on your first slide, was the title of your PhD thesis or
this one?
Surgical indications of flatfoot and ankle replacement.
Yes.
I think it's a very broad spectrum.
Yeah.
It is maybe the title of your PhD thesis.
Yeah.
In the future. Okay.
In the future.
And then you deal with two different topics.
Yes, of course.
Okay. And the one is a meta-analysis, and the second one is maybe an overview article, I think.
Yes, maybe.
So
yes, the second one will be a very
very difficult review article.
Please.
Your second topic is a review article, I think.
It's a review article, but we will decide it when we finished with the data collection. So we are in the selection phase, and I don't know how many data we will have. Will it be enough to a meta-analysis or only a systematic review? I don't know it yet.
Okay, I understand. Thank you.
Thank you. Just a question regarding the first topic. You mentioned lots of complications, possibilities for the ankle replacement. But you didn't mention the malpositioning and the bone collapse. Did you find some data regarding that?
Yes, these are a type of. I think the type of loosening. So the main problem was that these complication groups were overlapping, and I didn't find precise data about these types of complication. For example, as you mentioned.
I see. And my second question is.
So I don't know the proportion of this.
I see. Maybe it would be interesting just to search some data regarding that. The second question is regarding the second topic. So you are talking about the different surgery types of different from different indication. So I think it's very hard to compare, different indication to different surgical treatments. So I don't know how you plan to deal with that.
Yes, the main viewpoint will be that we would like to make this comparison per stages, and until now we didn't have comparison like that. So in each stages we would like to collect all of the surgical techniques and make the comparison per stages. Yes.